Good evening, everybody, and welcome to another episode of Corpus Forum. I am your host, Evelyn Nwesugwa, and with me in the studio are two wonderful core members who are here to discuss with me the impact of substance abuse among Nigerian youth. I'll let them introduce themselves and then we'll get right into business. I'll start with you by my right hand. Please introduce yourself, Doctor.
My name is Aisha Saad Ahmed, a serving corps member in Maiduguri and a member of the medical CDS group.
You're welcome, Doctor.
Thank you.
And by my left-hand side?
My name is Amin Ibrahim, a medical doctor doing my NYSC in Mamman Shua Memorial Hospital, Maiduguri.
You're welcome, Doctor. We are so glad that you joined us today. And we'll get right into the business of today. We're here to discuss about the impact of substance abuse among Nigerian youth. And I really want to know, Doctor, I want you to give us a well-detailed of what substance abuse is.
Substance abuse can be defined as habitual or chronic use of substance or substances that are harmful to the user or the society in a manner that are such that use not for medical purpose. So, and this word substance abuse, it encompasses a lot of various activities ranging from substance or drug addiction, drug marketing, drug trafficking, and improper sales of drugs. All those things are called substance abuse because you are abusing the substances. So vis-a-vis the habit of interchanging words or calling certain things by the wrong name, you will find that substance abuse is used and it refers to drug addiction. So sometimes you find that it is used interchangeably, but generally it encompasses a lot of things from drug trafficking, improper sale of drugs, drug addiction, and some other forms of drug sales and crimes related.
Thank you so much, Doctor. So you've heard what the doctor has said, and we want to know, Doctor, what commonly used drug is it that it is being abused by the youths? What are those common drugs that they abuse?
Well, the common drugs abused by youth in general is the marijuana, otherwise known as weed or wee-wee. It's usually abused by youths because I would say it is the most common one that is present in Nigeria. And then in cough syrups also, you can find codeine in some of them. So the youth also have access to that and they will abuse it also.
That's true. I know of codeine. I'm very familiar with codeine. And it's not just codeine, no. Any cough syrup at all. When you abuse it, when you overdose yourself with it, you are abusing yourself. Because sometimes you go to pharmacy, a pharmacist will prescribe a drug for you and will also write the direction how you're supposed to take it. They will give a direction you take morning, afternoon, and night. But you, because you're looking for fast healing, you will not take the whole tree at once. By doing that also, I believe they are abusing the drugs, right, Doctor? If
true.
I'm not wrong.
That's true.
You see, so by doing that, you're abusing your drugs. So you should stop that. It is very bad for your health. And so, Doctor, do you think that social media has a way of influencing this drug abuse? Do they have a way, in one way or the other, in support or encouraging youth to abuse drugs?
Yeah, certainly social media plays a great role in influencing the way society behaves, the way we act, and the way we do our day-to-day activities. So with regards to drug abuse, social media can either affect it positively or negatively. For example, there will be no one that will just wake up in a single day and you say this guy has become a drug addict.
True.
So usually it is a process.
Yes.
If you look at those people that tend to abuse drugs, there are times when they were not drug addicts at a point. So there will be a time then they will say, let me experiment and see what do I feel? What will I feel if I take this substance?
Out of curiosity.
Yeah, out of curiosity. So that's what we call experimental use. So he will say, let me just take it and see. If he doesn't get what he desire, then he will say, maybe let me try one more time. So around that period is what we call experimental use.
Okay.
So depending on what he gets after using the substance, he will now start to use it occasionally.
You see?
So we say it is now occasional use. So after his body is trying to become used to the substance, so he starts taking it regularly. So you say it is a regular user. Then from there you become a chronic user or habitual user.
You see?
From there, if you become a habitual user, you are now a drug addict. So from drug addiction, you now become what you call dependence. You get what you call dependence. So dependence is in such a way that your life is almost depending. The substance is almost controlling you. And if you don't take, you get what you call withdrawal symptoms. So withdrawal symptoms is that your body is so used to the substance to the extent so that when you don't take it, your body starts getting sick. You get combination of non-specific symptoms ranging from nausea, vomiting, fatigue, fever, all this, even confusion, agitation. Someone becomes agitated, is angry and all that. So all these are some of the symptoms. And that's why even if you are advising someone to quit, you don't tell him to just stop at once. It is usually a process. Otherwise, even stopping, quitting can kill you as well. So you have to follow a certain process. So this is to say that there is a trend you have to follow before you become a drug addict. It's not just in a single day. So social media, in other words, can influence how you see. You see someone is smoking, you say, let me also try. He looks cool. You see someone sipping alcohol, he was angry, he says, let me sip alcohol. So you also say, let me experiment and see, out of curiosity. Then it can also affect it positively in a way that you have seen someone drink alcohol, become addicted, and he has destroyed his career, destroyed his life, and you take it as a lesson. Someone smokes, he gets lung cancer. Someone drinks alcohol, he gets liver cirrhosis or liver cancer. You get. So all those things are things that you see and you say, let me try to avoid. And certainly social media plays a significant role in that aspect.
That's very knowledgeable, doctor. So if you're someone that you want to try a particular substance because out of curiosity, maybe you saw it on a video, in one of these musical videos, or in a movie, or your neighbor is behaving in a certain way, out of this substance that he or she has taken, you need to be very careful, because what do they say about curiosity? That curiosity kills the cat. So for you to even think about doing that first, you should first of all think about the consequences that comes with it. It's not just about going into it and taking it and thinking that you'll come out of it. No, you need to be very careful, for drug is very addictive, and getting into it is easier than when you're trying to find your way out of it. Because just like doctor said, if you get into it and you try to get out of it, it might kill you if you don't take it in a gradual process. So we want to know, doctor, do you think family and communities have a way that they influence a particular person, a youth, in taking drugs to the extent of them abusing it? Because in some families, you find out that some of these drug addicts that we see on the streets today is not because they want to, but some of them, when you listen to their story, you discover that some of them get into this as a form of cry for help. Maybe in a family, they are in a family and their family don't notice them because maybe they are one of the children that are not so intelligent, they are not smart and all of that. Okay. So the family tend to pay more attention to this other sibling of theirs than the other. Yeah. So by abusing these drugs, they are like crying out for help to their parents to be able to notice them. So do you think that this is also a part of what influences a youth to abuse drugs? And do you think is a good thing?
Yes, I would say family members and community play a great role in enhancing a youth to indulge into drug abuse. Because when someone is in a hardship, instead of that person to go out to his family members or to community elders to seek for help, and then they don't render a helping hand towards him, or they don't give him a listening ear, And so he'll go out to another place asking for help or other things like that. And that's when he'll meet other people or drug addicts. And now they will start like telling him, try this, you'll have peace of mind, try taking this, you'll be in a state of comfort or things like that. And before you know it, he has already become a drug addict. And just like you said, because they are not being paid attention to, they will even go into it, they'll start doing it. As they are doing it, like initially at the first stage, it won't be noticed. And then before the family gets hang of it, they've already become addicts. And so it will become a very big issue to the community members and to the family as well. And I would say it is not a good thing. Family members ought to pay good attention and equal attention to all the family members. Everybody should be paid equal attention to listen to this, listen to the other. There shouldn't be preferential treatment between children.
You see, because these are the things that actually causes problem in a family.
Exactly.
You go in a family, there are maybe like 5, and you discover that one is out of place among the 5. You will be wondering, but parents, it is your duty. You are the ones that decided that you want to give birth to this child. So it is your responsibility that you give equal attention and rights to your children. So back to you, doctor. We want to know, what are the risks attached to this substance abuse, both mental and physical risks attached to it? What are those risks?
Okay. So when we are looking at the risk factors or the predisposing factors, what predisposes an individual to take drugs, we tend to look at it in several ways. Sometimes we classify these predisposing factors into biological risk factors, psychological risk factors, and social risk factors. So if you look at the biological risk factors, there are people who are biologically predisposed to taking substances or becoming drug addicts. For example, research has shown that people who are born with certain disorders, like what you call attention deficit hyperactivity disorder. It is a form of disorder in children, ADHD. They are born with it. These children that are born with ADHD, they are at more risk of becoming drug addicts later in life than those who are not born with the disease. Other things is that if you are from a family that you are born of a parents that take substances or that are drug addicts, you are likely to become a drug addict than those who are not born of families that take drugs. Another research has shown that even among siblings, if you have a twin brother, especially identical twin, so the risk factor increases with the relationship between the two. So even the risk of having becoming drug addict in non-identical twin increases with identical twins. So if you are identical, you are at risk of having, I mean, if you are identical twin and one of the twins takes substances, so you also have higher chance than others that do not have a addict or who that doesn't have a twin addict. If I can say in that case. So this is biological risk factors. These are things that you may have little control over. But that being said, is not a guarantee that you are going to become a drug addict, but it predisposes you, it adds additional danger, it poses a greater risk of becoming a drug addict than others who don't have. So there are psychological risk factors, people who have anxiety disorders. So they are, so usually they tend to take something that will calm their nerves. So these disorders, like anxiety disorders, antisocial personality disorders, they all make someone at a greater risk of becoming a drug addict. And of course, there are social risk factors attached to it. Some even believe that poverty plays a great role. The society where you stay, the friends, the peer pressure, pressure from your workplace, and even depression or grieving if you have lost a loved one, or if you are having difficulty in your relationships and the rest. So such things predisposes someone to becoming a drug addict. So if you are looking at the risk factors, you look at it in various stages. So I think these are some of the risk factors that I can be able to see.
Oh, that's very wonderful, doctor. So with what you've explained now, it is important as as a person, or say as you've given example of identical twin, that they should go for test, right? So that they see if they have these tendencies of abusing drugs in them, in their genes, or can you explain further?
That's not what it means.
Okay.
Because if you are twin and none of you takes alcohol, none of you takes substances, none of you is a drug addict, then that's all. You don't have that. What we are saying is that if your twin brother is a drug addict, because you have almost similar biological makeup.
Okay.
You have almost genetic makeup the same with that individual. So if he's a drug addict, it puts you at a greater risk of becoming a drug addict, because your twin brother is also a drug addict. But if none of you is a drug, that means your risk factor is as the same as any other person who doesn't take the drugs.
I understand better now. With the deeper explanation, or better explanation he has given, you've understood it better than I have now. So back to you, doctor. We want to know, what are those common signs and symptoms when one starts to abuse drugs?
Well, I would say the most common sign you see is withdrawal from people. They tend to become antisocial. They don't like mingling with people. They will start distancing themselves from other people, but they will just be sleeping all the time, because whenever they are high, they tend to sleep. So they will distance themselves from people. They will tend to sleep. You see their mouth sometimes, it tends to become blackish.
Okay.
They will be having red eyes sometimes. Not necessarily anybody that has a red eye is a drug addict, but it is also one of the common signs you see in them. They have the redness of the eye. You see them, their mouth is always dry. Sometimes you see most of them always in a hurry. They will always be in a hurry.
Where are they going? Always anxious.
Yes, they're always anxious. You see, they're always in a hurry. I don't know where they're going actually.
Adrenaline is high.
Exactly, because the medicine is going through their body, and it's making everything to be hyper. So you see them, everything they're doing is hyper. I would say that those are the common signs you see in a drug addict.
Okay, thank you very much for that. So I want to know, what do you think, or how best do you think that our cultural practices and our religious practices can come in to be able to tame or control this drug abuse that is taking almost over all our youths in Nigeria?
Okay, so thank you very much. I think culture also plays a great role.
True.
Here, most of our cultures in the northern part of the country, they tend to frown at drug addiction.
Yes.
They tend to frown, but there is a growing trend of people becoming drug addicts in the society.
True.
So I think another thing is that we need to have various community orientation programs.
Yes.
People should be informed either in gatherings, in churches, in mosques, about the dangers that then another thing is that, because like we said, this drug addiction is not something that happens in a single day.
Yes.
So the community should be more open, should embrace the members. We should have community leaders who are respected people in the society in such a way that if they see someone drilling away from the norms, the normal cultures in the society, they can easily call him and put him to order, and even help him before he becomes a drug addict, or before he becomes dependent. So these are some of the things that I think most of the things, the religions, the various religions we practice, they tend to frown at such acts in the society. Then also law enforcement agents or law enforcement agencies, because this drug addiction or drug abuse or substance abuse, it encompasses, like I said, of a lot of things, ranging from sales of the drugs. So there are various laws in Nigeria that makes some drugs are what you call prescription medications, meaning you cannot have access to them until you have seen a doctor. He has prescribed properly, not just anyone. So he has prescribed properly. That's the only time such drugs will be dispensed. So that's one. Secondly, we have laws that also makes such agencies to go around and check see what are you selling, how do you dispense it, do you sell it properly, and all that. So also drug marketing, so that drug production also. So all those things are what helps the society reduce the burden of this drug abuse or substance abuse.
Thank you very much, Doctor. With what Doctor has just said now, you discovered because we Nigerians are fond of, today I had a stressful day. It seems I'm having headache. Piam! You have paracetamol. You have like 5 paracetamol. You swallow everything without going to the doctor or a pharmacist to explain to him the symptoms you're having, so that he will prescribe a good drugs for you or medication for you, and also give you the direction of how to take it. But no, we are set and one, I am a doctor myself. You go and buy whatever you want to buy and take it yourself. By doing that, you're causing harm to your health that you do not know. So it is very important that for whatever symptoms you feel, you go to a physician. Tell him all the symptoms you feel, and let him be the one to prescribe medication for you. Say no to safe medication. And I want to know, Doctor, please give a word of advice to those youth outside that are trying, maybe out of curiosity, out of peer pressure or videos or what they see. What would you advise them that they should not try to do drugs in any way?
Well, everybody out there, I would advise you that if you have not started, don't start it.
True.
Because once you start it, then I would say there is no going back. And I would not pray that you even start it.
Amen.
And if you are into it, I'll pray that you start to withdraw from it. As Doctor said earlier, that it's a gradual process starting it.
Yeah.
So stopping it also is a gradual process.
True.
You can't stop it overnight. So just start with the gradual process, stop it little by little, reduce the dose you are taking, and then seek for help. Go to anybody you can trust. Tell them your problems. I will ask for advice from them.
All right, thank you so much, Doctor. And what about you, Doctor? Your word of encouragement or advice?
Yes, I would like to encourage those who are into the drug should take part in what we call rehabilitation.
True.
This rehabilitation is a process that rehabilitates them, that stops them from taking these substances. And it is a combination of different methods, including drugs, biological agents like drugs that they are given, then psychological reorientation, including a study group that helps them be themselves, express themselves, then also social interaction. Here we tend to encourage family to provide social support, also engage them in activities like handwork. If they are jobless, we get them job and such things. So these are what will help someone to become completely rehabilitated.
Thank you so much, Doctor. I believe that you all had a great time as much as I did. And to this, we have come to the end of our today's episode of Corpus Forum. I'll see you next week, same time. I am your host, Evelyn Umwesuka. Good evening.